What is a VBAC? If you're expecting and have had a cesarean delivery in the past, you might be wondering about the possibility of having a vaginal birth this time around. Let's break down what a VBAC is and what it entails. A VBAC, or vaginal birth after cesarean, is when a woman who has had a previous cesarean section gives birth vaginally in a subsequent pregnancy. This option is becoming increasingly popular as more women and healthcare providers recognize its benefits. One of the main advantages of a VBAC is avoiding major surgery. Unlike a repeat cesarean, a VBAC doesn't involve the risks associated with abdominal surgery, such as bleeding, blood clots, infection, and damage to the bowel or bladder. Additionally, you'll likely have a shorter hospital stay and recover faster, allowing you to get back to your daily life more quickly. For many women, experiencing labor and vaginal birth is an important part of the childbirth process. A VBAC also means your baby may have an easier time starting to breathe right after birth, which can be a significant advantage. However, it's crucial to understand the criteria for attempting a VBAC. Generally, women who had a previous low transverse incision on the uterus are good candidates. This type of incision is the most common and is considered safer for a VBAC. Women with previous low transverse cesarean incisions or those carrying twins can also be eligible. The success rate of a VBAC varies but is generally quite high. Studies show that about 60 to 80% of VBAC attempts are successful. If you've had previous successful VBACs, your chances of success increase significantly. For example, if you've had one previous successful VBAC, your success rate jumps to around 87%, and with 2 or more previous successful VBACs, it can be as high as 90% or more. Despite the benefits, there are risks to consider. The most significant risk associated with a VBAC is uterine rupture, which occurs in about 0.2% to 1.4% of cases. However, most mothers and babies recover well from this complication. Other risks include maternal hemorrhage, infection, and blood clots, but these are similar to the risks associated with any vaginal birth. To determine if a VBAC is right for you, it's essential to discuss your options with your healthcare provider early in your pregnancy. They can help you understand your specific situation and the potential risks and benefits based on your medical history. In summary, a VBAC is a valuable and often safer option for many women who have had a previous cesarean delivery. It offers numerous benefits, including a faster recovery and the chance to experience a vaginal birth, but it's important to carefully consider the risks and discuss your individual situation with your healthcare provider.